Now, how do most people find out that they have something that's an issue? Because I would imagine they don't come to you and say, "I need to be screened."
So I think that's that's a great question, and I think what we're trying to do is become more proactive, educating people. And I think part of what we do here at Zwanger-Pesiri, aside from just being a business that takes pictures and then interprets them, is we also want to be helpful to the community by educating on them what's available. And some of the things that are more prevalent today under this screening umbrella would be obviously mammography for women.
Right.
I think lung screening has become something popular in the sense that it's become more mainstream, that we understand the value of it, that we can get that lung cancer, so it's still curable.
Right.
Another thing that we're starting to do more and more of is prostate imaging for screening, meaning that typically in the past, the way that we would screen you for prostate cancer would be with a blood test called PSA, which is something that would measure the prostate antigen in your blood. Typically that number should be below 2.
Okay.
If that number starts to rise, it starts to potentially mean there's a concern that you could potentially be developing or have prostate cancer.
Okay.
It's not an exact science, and typically what would happen is if your PSA started to elevate, we would do a biopsy. Unfortunately, it's something we call a blind biopsy, meaning that we're going to sample pieces of your prostate gland. The problem with that is we could potentially miss the cancer, tell you that it's normal.
Right.
You come back in 6 months, have the blood work done, and your PSA continues to rise, which means, oh boy, we missed the cancer 6 months ago and it's been developing for 6 months. So what's changed? We've now realized that a better way to manage and screen for and potentially follow cancer is with imaging and radiology. So we use the MRI machine,
Okay.
and we take pictures of your prostate gland, and we can use it to see if there is a cancer,
Right.
and if there is it progressing? Is it starting to develop into something that can potentially break outside the prostate gland and become a bigger problem? So
Right.
screening and radiology has totally changed the way we discover prostate cancer and also the way we manage it going forward.
Gotcha.